Just waiting a little bit for everybody to join us. Hello, and thank you for joining us. I'm Ramon Parsons, Director of the Tisch Cancer Institute and Mount Sinai Cancer. I'm delighted to host today's webcast on optimizing cancer care in the age of COVID. Over 80% of our patients have returned to our cancer for their cancer care. For the 20% that have not, we understand that you must feel like you're in between a rock and a hard place. On the one hand, concerned about exposure to COVID, and on the other, concerned about taking care of your cancer. I want to assure you that our outpatient cancer clinics are very safe and ready for you. We have lined up some of our cancer specialists today to talk with you about how to stay on track with your cancer care and maintain your treatment regimen to ensure the best outcome for you. They will also talk about the safety measures we have put in place to protect everyone who enters our facilities. Just to clarify, for those of you who may not know what the Tisch Cancer Institute is, it's the umbrella for cancer research and cancer care throughout the Mount Sinai health system. We are proud to be a National Cancer Institute designated cancer center. Before we get started, let me go over a few housekeeping items. First, this town hall is recorded and it will be available for those of you who could not attend and join us today. Second, there's an opportunity to submit questions online towards the end of the session. We want to hear from you and we will answer as many questions as time permits. And third, please let us know if there are any barriers you are facing for your care. We will do our best to take care of them, and you can enter those questions or barriers in the question answer period at the end of this time. And now, let me introduce my colleagues. Dr. William O, Deputy Director of the Tisch Cancer Institute and Chief of the Hematology and Oncology Division of Medicine. Dr. Lewis Isola, Director of Clinical Cancer Programs for the Mount Sinai Health System. And Dr. Cardinal Smith, a Chief Quality Officer for Cancer at the Mount Sinai Health System. And now to get started, I'm going to turn it over to Dr. O to talk about telemedicine visits as an option for your cancer care. William?
Thank you, Dr. Parsons. By way of introduction, I'm a prostate oncologist and I see patients in the Ruttenberg Treatment Center at Mount Sinai. And I want to really point out that we have multiple ways for you to seek care at Mount Sinai. For example, obviously we're seeing patients in person, and we've made many changes to the clinic that you'll be hearing about from Dr. Isola and Dr. Smith about making it more safe. For example, we've extended our hours. Our outpatient treatment center is now open 24 hours a day. And this allows us to spread out the volume and accommodate social distancing. You will not recognize our waiting room. It looks completely different because patients are being carefully scheduled to allow social distancing. In addition, telemedicine has really transformed the way we deliver care. We know that in the midst of the pandemic, and even to this day, many patients may not want to come into New York City or see us in person. When that's possible and when it's appropriate, we've been able to have labs drawn locally, for example, and to do these telemedicine visits so that we could actually give advice and give care over the internet. This is not complicated. You can do this very easily by signing up through MyChart. And if you have trouble with it at all, you just contact your doctor or any of the administrators, and we can walk you through how to sign up and also use alternate approaches like FaceTime. When we look back to earlier in the year before all of the events of the last few months, I can tell you that we've gone from just a few visits through telemedicine to really now hundreds that we're doing every week. And many of our patients have been able to get the care without interruption that they need. But ultimately, we also recognize that patients need to come in for specific therapies, and those patients are starting to come back. And as Ramon said, as Dr. Parsons said, we're able to deliver the top quality care that we expect for our patients for all of the different cancer needs that they have. We also have an extensive geographic network of providers. One of the things about the Mount Sinai Health System that is a true advantage for delivering cancer care is that we have hospitals in every borough, and affiliate members really on Long Island, Westchester, in New Jersey, throughout the tri-state area. And this has allowed us to deliver care by creating opportunities for patients to get their care closer to home when necessary. I'm going to pass it over now to Dr. Isola to talk a little bit more about what the Mount Sinai Health System has gone through over the past several months.
Thank you, Dr. O. Good afternoon, and thank you for joining us to discuss how the Mount Sinai Health System and the Tisch Cancer Institute are working to optimize cancer care for the COVID-19 era and beyond. I am Dr. Lewis Isola, Director of Cancer Clinical Programs for the Mount Sinai Health System. The first case of COVID-19 in New York happened just over 100 days ago near Mount Sinai Hospital. And what followed over the next 3 months was last seen just 100 years ago during the Spanish flu. In early April, our hospitals had over 1,600 cases of COVID-19, and 100 more were in our emergency departments. Our physicians, nurses, scientists, and staff worked around the clock to save thousands of lives. By the end of April, cases started to decline in New York City. The number of patients discharged from our hospitals consistently surpassed new cases. Let me illustrate. On April 11, Mount Sinai Hospital had 667 COVID-19 inpatients. By June 7th, that number was down to 33. At the peak of the pandemic, we had tents in Central Park across the hospital. That area is once again a green lawn now. Our cancer program remained fully open during the pandemic, and while the worst is behind us, our precautions remain firmly in place. In the lobbies of our cancer facilities, we observe strict social distancing while patients are being screened and while they're being greeted. Areas where patients, staff, and visitors congregated in the past, for example, elevators and waiting rooms, are closely monitored now. We optimize provider schedules, workflows, and the use of telemedicine so as to drastically reduce wait time and the use of waiting areas. Next, you will hear more details on screening and oncology care delivery, but I want to leave you with a very important message. Timely care is critical, whether for a new cancer diagnosis or for an existing condition. At Mount Sinai, we managed to provide a safe environment and exceptional cancer care throughout the pandemic. As we look beyond COVID-19 and we become re-energized by this incredible challenge, we are more committed than ever to our mission of providing outstanding cancer care throughout the health system. Next, let me introduce Dr. Cardinal Smith, who is our Health System Chief Quality Officer for Cancer. Cardi?
Yes. Thank you, Dr. Isola. I'm glad to speak to you all today about what Mount Sinai is doing to ensure the safety of our patients with cancer. We have put several processes in place. Before your appointment, we are calling you to ask if you have any COVID-19 related symptoms. For those patients enrolled in our patient portal called MyChart, we are sending messages to remind patients of all the processes that we have in place. Upon arriving, you saw the pictures previously of what our lobbies look like. In the lobby, we will ask you again about any COVID-19 symptoms and will perform a temperature check. Patients showing symptoms will be placed in an isolated room for further evaluation and coronavirus testing as determined by your clinical team. Throughout your visit in our center, you will notice that all patients and staff are required to wear face coverings, as well as appropriate protective equipment. Patients and visitors will be provided with a mask if needed. Please be aware of our visitor policy. We are still adhering to visitor restrictions in order to minimize the number of people in our facilities so that we can adequately socially distance and keep our patients safe. There are exceptions, however. If you, the patient, have a cognitive or an intellectual impairment, a visitor can accompany you to your visit. We can also make exceptions for patients on a case-by-case basis. It is important to discuss this with your primary oncology team. During your visit, there is no better time to emphasize the importance of hand hygiene. We recommend that you wash your hands with soap and water for at least 20 seconds frequently. We will also make sure alcohol-based hand sanitizers are readily available for all of our patients, family, and staff throughout our centers in case you don't have access to soap and water. In terms of social distancing, we're minimizing contact between patients by spacing furniture, minimizing the number of patients in our waiting areas, and scheduling more time between appointments. We are monitoring the number of patients in elevators. You may see visual aids to show you what our elevator safety guidelines are. We also encourage the guidelines for social distancing, which is to keep 6 feet between each other. It's really also important for you to stay on time for your appointment and not to come any earlier than 30 minutes or 30 minutes after your allotted time. Behind the scenes, there is much work going on as well. You may not notice it, but all areas are being rigorously disinfected, including our waiting rooms, patient rooms, and high-touch surfaces. Patient care areas such as exam rooms and treatment rooms are disinfected thoroughly between patient visits, and high-touch surfaces such as doorknobs and kiosks are continuously disinfected. Staff are self-monitoring for symptoms of COVID-19 twice a day. In addition, we are testing employees who may have been exposed or who have symptoms related to COVID-19. During this time, we are also testing all of our patients receiving chemotherapy or immunotherapy once a month as a minimum to identify anyone who may be at higher risk for complications. We also recognize that we have cancer patients with COVID-19 who continue to need some form of treatment. All of our patients who are being cared for with COVID-19 are isolated and treated in a designated unit that is away from those who do not have COVID. Whether you need supportive treatments like blood transfusions or hydration, or you need cancer-specific treatment, we have an area available for you. Thank you, and I would now like to pass it back to Dr. Parsons.
Thank you for this detailed information for what patients can expect for their visit, Dr. Smith. As you can see, we have a new normal here at Mount Sinai. We are sparing no effort to keep you safe when you visit us. We hope this virtual conversation starts the dialogue on how to keep your cancer care on track from the doctors you need at the health system you trust. We have remained open and continue to be, and continue to be, and are here for you at all of our sites. Dr. O?
Yeah, I really want to emphasize that, Dr. Parsons. The Mount Sinai Health System mission is to provide compassionate patient care with seamless coordination and to advance medicine through unrivaled education, research, and outreach to the many diverse communities we serve. We care about you, and we consider it a privilege to care for you. Your safety is essential to us. There are many questions that come up, and we have a page for frequently asked questions at the Mount Sinai Safety Hub, which is shown at this website here. In addition, there are many resources, including the MD Cancer, 844 MD Cancer number, and of course, your oncologist. So we really encourage you to use these resources to understand what Mount Sinai is doing, what we're doing in the Cancer Center in particular, and also, of course, the resources of your own cancer team. Dr. Parsons?
Okay, so at this time, we invite you to submit your questions through slido.com. You should be seeing that now. You can see it on your screen, hopefully. You can either go to their website in the browser and enter hashtag Sinai, or use your phone's camera to scan the QR code. We'll organize your questions and have our cancer experts weigh in. I'll give you a minute to submit questions, and in the meantime, we have heard from a lot of patients who are nervous about chemo and potential risks. And Dr. O, can you address this first question, please?
Yeah, obviously, a patient who needs chemotherapy or some other immunosuppressive therapy is getting that treatment because they have cancer, and cancer that needs that treatment as soon as possible. Your doctor is going to make a decision about the risk-benefit ratio for giving you a treatment such as this. And of course, in the setting of COVID-19, we are all very nervous about the additional risk of this infection. The truth is that we have been testing many of our patients before they come in for chemotherapy, and asymptomatic patients have a very, very low rate of infection. And in fact, part of this is the success of the social distancing and isolation that many people have been going through. And in truth, we can't reduce the risk to zero, but what we have seen is that we are very able to treat our patients with chemotherapy and other immune suppressive therapies in order to really give their cancer treatment the optimal chance of working. And what I have found as an oncologist myself, and my colleagues can attest to this, is that we're doing everything we can to protect the patients as much as possible. And we have seen that this is working successfully because of all these mitigating measures that you've heard about today.
So here's a question for Dr. Smith. Is it safe for me to be with a gathering of family or friends? And how much should I isolate myself? And then the third part of this question is, what special precautions should I take when I'm around with family and friends?
These are all very good questions. I think it is important, particularly for patients with cancer who may have a higher risk of having poorer outcomes if infected with COVID-19, to make sure you're practicing all of the usual social distancing habits. So staying 6 feet apart, wearing your mask, practicing good hygiene. Really at this moment, I think we would say continue to do what you have been doing, trying to isolate as much as you can, staying only with those close family members that you have been with while you've been in quarantine.
Okay, thank you. Here's another question. This one's for Dr. O. Why should I come in for a visit instead of doing a telemedicine visit?
Well, as I mentioned earlier, there are obviously times when the main purpose of a visit is to talk about the clinical situation, review symptoms over a telemedicine visit, look at labs that could be drawn locally. But there's no substitution ultimately for certain things. If you need treatment, you need an injection or an infusion, you have to come in to be able to get that treatment. There are also times when, of course, it's very important for your doctor to examine you or to really review your situation face to face. And as I mentioned during my earlier portion, there are times that we're actually alternating these, but in the end, there are going to be times when it's going to be best for your doctor and your care team to actually examine you, draw the labs at Mount Sinai, do some tests at Mount Sinai, and sometimes give you infusions. It's going to be very individualized. As the environment becomes safer and safer with all of the measures you heard about so far, I do feel very comfortable really expressing confidence that patients can come in safely and get the appropriate level of care that they need.
Okay, so here's a question for Dr. Isola. My husband is a taxi cab driver. Is it safe for him to work?
Well, the presence of the coronavirus in the community is, particularly in New York, is quite prevalent. So obviously we can't prevent people from going to work, but if they develop any kind of symptoms, they have to get in touch with their physicians and follow the testing strategies that have been developed. And we will talk some more, Dr. Smith will touch upon testing in the next few minutes.
So this is a question for Dr. Smith. Do you plan to test patients for COVID who are coming for routine scans and follow-up to reduce possible on-site transmission?
Currently, we do not require testing for folks coming on site who are not actively receiving some form of cancer treatment. Our screening guidelines in terms of calling ahead of time to screen for symptoms, for checking for symptoms upon arrival in our lobbies, including doing a temperature check and wearing a mask for both the patient as well as staff. All of these procedures really should be mitigating any potential risk of exposure and spread.
Okay, thank you. So here's a question for Dr. Isola. I heard COVID-19 tests may vary in accuracy. What is Mount Sinai's approach to address this?
COVID COVID-19 testing falls into two separate categories. There are tests for checking for the presence of the coronavirus, and then there are tests to check for the presence of antibodies to the virus. At Mount Sinai, we use the gold standard for checking for the presence of the virus. That test is called PCR. It has very high sensitivity and specificity of well over 99%. And at Mount Sinai, our scientists have developed an antibody test that is being used as a standard in the US for the development of other antibody tests.
Okay, here's a question. Let one of you pick answering this. Do you recommend postponing annual cancer testing, like using screening methods like radiological screening methods?
You mean like a colonoscopy or PSA test? I mean, obviously, colonoscopy may be a very good example, or mammogram, of something that might be able to be postponed for a short period of time. But you know, what you've been hearing from all of us is that we're kind of getting back to normal. One of the good things about New York is that we are definitely in a much better position than we were, and we're continuing to head in the right direction. Unfortunately, that can't be said for all parts of the country, but we've done a really good job in New York of controlling the spread of this virus. The danger of waiting too long for getting your mammogram or your colonoscopy is that there is a risk, obviously, with screening tests that they're really intended to pick up cancer early. And I think you have to talk to your primary doctor, you have to talk to your oncologist, but I would strongly urge that you have that conversation, because for many of our patients, we did delay certain therapies. I made a case-by-case decision with my patients about what they could delay and what they shouldn't, but that was in the midst of the pandemic. You saw the curve from Dr. Isola's graphic. We're in a much better place, and it's very important to at least start planning for this. And obviously, you have to feel comfortable. Patients are all wearing masks when they're getting these procedures. The doctors and the staff are wearing masks. We're all doing all of the hand washing and other social distancing as much as is possible. But I think that you don't want to delay these important prevention measures too long after discussing with your doctors.
Here's a question for Dr. Smith. What are the precautions being put in place at the Dubin Breast Center for routine mammograms?
So all of the same precautions that you've heard us just mention in terms of checking in the lobby, screening for symptoms, checking for temperature, social distancing measures, spacing out appointment times, practicing very good hand hygiene, wearing masks. All of these procedures are also being conducted at the Dubin Breast Center.
Here's another question for you, Dr. Smith. I'm worried about taking the subway. Is there parking available?
Yes, so we do have discounted parking available for our patients and families. There is a lot, the cost is $20, and there is a shuttle. The lot is located on Madison Avenue between 104th and 105th Street, and there is a shuttle that can drive from that lot to our main treatment areas.
Okay, let me just see, there's many different questions have been coming in, and here's one. My oncologist recommended tripling the dose of Lupron for my breast cancer. This was a great help to avoid visits during the peak of COVID. What are the risks of 3-month injections of Lupron versus regular 1-month injections? Does anybody want to field that?
Well, I think I should, since I'm a prostate cancer doctor, Dr. Parsons, and it's completely safe. It's basically a 3-month depot, meaning you're getting a shot that lasts for 3 months because it stays in your skin and slowly releases. And there's no difference between a 1-month injection and a 3-month injection except the size of the dose. So it's perfectly safe. That's a good example of how you can change the way you might have done things in the past. I routinely use a 3-month Lupron depot because that's what our patients with prostate cancer receive.
Okay. I have another question about testing. Should caregivers and family members be tested for COVID?
I can answer that one. I think at this moment, caregivers should be tested for COVID if they are displaying any symptoms. or if they have recently been exposed to someone who is known to have COVID.
Here's another question for you, Dr. O. I got notice from the Prostate Cancer Foundation that Lupron and Zytiga can help fight against COVID-19. Do you know anything about this?
Yeah, we are studying this here at Mount Sinai, and this gets to one of the strengths of being at a place like Mount Sinai. We're a research hospital, we're a clinical care hospital, and we really are able to do both. So the observation has been made that men seem to have more symptoms when they get infected with COVID-19 than women, and we don't understand why. And one of the hypotheses that seems to be bearing out with studies that we're doing here at Mount Sinai is that testosterone itself may actually increase the risk of a severe infection. And we're testing this hypothesis. That doesn't mean that every man who gets infected should get a drug like Lupron, which lowers your testosterone. But we have seen that in men who are already on Lupron, that it might actually protect them somewhat from the side effects of COVID-19. So more research is coming on this fact.
Mm-hmm. So here's another question. I think this Dr. Isola maybe would like to handle this. If I come to the clinic for a chemo injection, will I be tested first for COVID even if I have no symptoms? If yes, will the test be on the same day as the injection? And how long will it take to get the results?
Good question. The test that remains the gold standard for the presence of the virus is a test that still takes a few hours. And we do test every patient who is going to receive chemotherapy for the presence of the virus. And we still use, for the vast majority of those patients, the test, the gold standard test. So therefore, under most circumstances, we'll test you a day or two ahead of time. We do have at our, in our hands, rapid tests that can give us an answer within an hour. So for some patients for whom coming to the center a day or two before chemotherapy is literally impossible, we can test those patients right at the time of coming for chemotherapy, and we will have the answer within an hour. But yes, everybody does get tested in advance of receiving chemotherapy.
Okay, so again, I want to say that if there's anybody experiencing any barriers to their care, please let us know about them. We're here for you. We want to make sure we can reach out to us, and we want to make sure we can facilitate your being able to visit to the best of our ability. And also, I just also want to ask you if there are any other topics you want to hear about in the future. Please let us know through our question format here, and we can address them in future events like this. We also have some other questions. So here's a question that's more of a statement, actually. I need a scan where I'm in the scanner for over 20 minutes, and the diameter of the scanner is not far from my mouth. Others have been in the scanner before me. Do you disinfect these machines inside too? Thanks. So how are we doing with that? Maybe I could ask Dr. Smith on that question.
Sure. So in all of our exam areas, high touch surface areas, meaning places where people touch a lot or have been in between patients, we are wiping that down and disinfecting them. And then at the end of the day, doing a more thorough, rigorous cleaning.
So I have another question here. Do aromatase inhibitors affect the immune system negatively? And I would assume the concern is increased risk of COVID complications.
I can take that. Yeah, hormonal therapy is not known to be immune suppressive. I don't think that there's any evidence that somebody with breast cancer, for example, on a hormonal treatment like an aromatase inhibitor should worry that they're actually immune suppressed. As we talked about earlier, there may be some protective effects of certain hormones in certain disease states, but it's still very poorly understood, unfortunately. And that's why we really want to continue to be at the forefront of answering these questions so that not only do we optimize the care for our patients, but that we publish and spread these results around the world because people look to Mount Sinai for being a leader in this regard.
Okay, great. So I think it's we're running out of time here. We're at the end of our 30-minute time frame. I just want to say thank you, everybody, for participating. Thank you for your questions, and hopefully these answers have been able to give you some insight. We hope to have more events like this in the future. So if you have any ideas or topics that you'd like us to cover, please let us know. We'd be happy to do so. Thank you very much again, and goodbye.
Thank you for
you.
joining us.
Say goodbye.